After the age of 60, something quietly begins to take freedom away from millions of people. Not all at once, not dramatically, and often without warning. It's not heart disease, it's not diabetes, it's not even arthritis. It's a very specific kind of pain. A pain that begins deep inside the hip. It spreads through the buttock. It runs down the back of the leg. Sometimes it reaches the calf, sometimes the ankle, sometimes all the way into the foot. For many people, it feels electric, like burning wires, like sharp tension, like something is pulling from the inside. And what makes this pain especially cruel is not just how it feels, but what it slowly does to the person living with it. At first, people ignore it. They tell themselves it's temporary. They rest a little more. They move a little less. Then they hear the same words again and again. It's just your age. Your body is wearing out. You'll have to learn to live with it. So they start sitting more, avoiding stairs, skipping walks, turning down invitations, and without realizing it, they begin to fear their own bodies. But here is something most people over 60 are never told. This pain is not normal, and it is not inevitable. That sharp, radiating, electric pain has a name. It's called sciatic pain. And in most older adults, it does not come from the leg at all. In fact, research and long-term clinical observations show that more than 40% of people over 60 experience sciatic-type pain at some point. Yet the majority are treating the wrong area, using the wrong movements, or relying on medications that only mask the problem. What shocked us most was this. When older adults use the right movements, in the right order, relief often doesn't take weeks. Sometimes it takes minutes. And today, I'm going to walk you through the only 4 exercises you truly need to relieve sciatic pain from the root, safely, gently, and designed specifically for bodies over 60. Before we continue, let me pause and ask you something important. How old are you, and where are you watching from today? And where does your pain travel? Down the back of the leg, along the side, or into the foot? Please write it in the comments. I read them carefully, because when one person shares their story, it helps someone else realize they are not weak, not broken, and not alone. Now let me explain why this topic matters so deeply to me, and why I approach sciatic pain differently from most advice you see online. For many years, I've worked closely with older adults and followed hundreds of real life stories from people in their mid-50s through their late 70s. People who were active, independent, and full of life, until pain slowly changed how they moved. I've seen people become dependent on pain medication just to get through a normal morning. I've seen others stop traveling because sitting too long hurt too much. I've seen confident people become cautious, hesitant, and afraid of simple movements. And I've heard the same sentence again and again. Maybe this is just what aging feels like. But here's what stood out over time. Relief did not come from pushing harder. It did not come from aggressive stretching. And it did not come from avoiding movement completely. Relief came when people learned how aging bodies respond differently to movement, and when they chose exercises that calmed the nervous system instead of irritating it. The most meaningful shift wasn't a new medication. It wasn't a trendy workout. It was understanding that gentle, intentional movement, done correctly, can change how the body feels, even later in life. If you're dealing with sciatic pain right now, chances are you've already tried what most people recommend. You may have stretched your hamstrings, pulled on your calves, rubbed the painful area, used heat packs, used ice packs, taken painkillers just to function. Some people are even told to walk more, believing that movement alone will fix everything. But here's the truth. The problem is not effort. The problem is direction. Sciatic pain is often felt in the leg, but it rarely starts there. In adults over 60, the true source is usually higher, either deep inside the hip or in the lower spine. As we age, spinal discs lose height, joints become stiffer, Deep muscles tighten from years of sitting and limited movement. One small muscle in particular plays a huge role. It's called the piriformis. This deep hip muscle sits very close to the sciatic nerve. When it tightens, which often happens with age, it can compress the nerve like a clamp. That's when pain shoots down the leg, and here's where many people go wrong. When you stretch only the leg, you're pulling on tissues that are not causing the compression. In some cases, aggressive stretching actually irritates the nerve even more. Medication may dull the pain temporarily, but it does nothing to reduce pressure on the nerve itself. When the medication wears off, the pain returns, often with more stiffness and more fear. This creates a cycle. Pain, medication, rest, fear of movement, and then more pain. Over time, this cycle weakens muscles, reduces balance, and places even more stress on the spine. The real solution requires a sequence. First, release what is compressing the nerve. Second, reduce pressure on the spine. Third, create space so the nerve can calm down. And finally, stabilize the body so the pain does not return. Without this order, relief is often short-lived. After years of observation, we stopped chasing quick fixes and started looking for patterns. We reviewed countless exercise programs, rehab plans, and treatment approaches. Most failed because they did too much too fast or focused on the wrong area. Eventually, everything narrowed down to 4 essential movements. Not intense workouts, not painful stretches, but therapeutic exercises designed specifically for people over 60. They require no equipment. They take only minutes a day, and most importantly, they work with your body. Let's begin. Exercise 1: Piriformis release. This is often where people feel the first real change. The piriformis is a small, deep muscle inside the hip. You never see it in the mirror, and most people have never heard its name. But when it tightens, it can press directly against the sciatic nerve. That pressure sends pain down the leg. To do this exercise, sit on a firm chair with both feet on the floor. Place one ankle on the opposite knee, forming a gentle figure 4 shape. Sit tall, relax your shoulders, lean forward just a few inches. Do not force the stretch. You should feel a deep, comfortable stretch high in the buttock, not sharp pain. Breathe slowly. With each exhale, allow the hip to soften. Hold for 20 to 30 seconds. Then slowly return upright and switch sides. Many people tell me this is the first time their pain stops traveling down the leg. That's not a coincidence. When the piriformis relaxes, the nerve finally has room to breathe. Now we move to the next step. Exercise 2, the Z lift position. After releasing hip compression, we reduce pressure on the lower spine. Lie on your back and place your lower legs on a chair or couch so your knees are higher than your hips. Your body forms a gentle Z shape. Let your arms rest at your sides. Allow your back to settle. Let gravity do the work. This position reduces spinal compression and gives the sciatic nerve a break from constant pressure. Many people feel relief within minutes. Stay here for 5 to 20 minutes, breathing naturally. When you're done, roll onto your side before sitting up slowly. Exercise 3, seated lumbar flexion. Now we gently create space for the nerve. Sit on a chair with your feet flat on the floor. Slide your hands down your thighs as you bend forward, allowing your back and neck to relax. Pause briefly, then slowly return upright, 1 vertebra at a time. Repeat 5 to 10 times within a comfortable range. When pain moves upward instead of down the leg, that's a positive sign. Exercise 4, deep core activation. This is the step that protects everything you've gained. Lie on your back with knees bent. As you exhale, gently draw your lower abdomen inward and flatten your lower back slightly. Hold for a few seconds. Relax. Repeat. This wakes up the deep, stabilizing muscles that protect the spine during everyday movement. When these muscles work properly, the sciatic nerve stays safe. Instead of chasing pain, you're restoring balance. Sciatic pain after 60 is not a life sentence. Your body is not broken. It simply needs the right kind of movement. Start gently. Be consistent. Even a few minutes a day can rebuild confidence, comfort, and freedom. Tell me in the comments which exercise you'll start with first. Your story may help someone else take their first step toward relief. We move forward together, one calm, confident step at a time.